Hello and welcome to Mentorship Masterminds, the PMI podcast where we deep dive into leadership, innovation, and personal growth. I'm your host Mahesh Deshpande, and I'm excited to bring another episode of Mentorship Masterminds. In each episode of Mentorship Masterminds, I talk to an industry veteran on topic that is instrumental in shaping our next generation leaders. This podcast is sponsored by Project Management Institute San Francisco Bay Area chapter, and we are recording it at the vibrant Golden Gate University campus. Today's episode is about healthcare management, and to talk to us about this topic, we have with us Max von Zeman, who is director at Stanford Healthcare. She is a trailblazer who is transforming healthcare by optimizing operations and driving innovative initiatives in healthcare sector. Max, welcome to Mentorship Mastermind. Max, you have an incredible experience in the healthcare sector as well as in public policy. What sparked your interest in healthcare? We would like to know more about your story.
So I originally wanted to be a physician. I grew up in a pretty blue-collar neighborhood and environment, and they always say you can only be what you see. And so I wanted to be the type of person that helped other people, and I knew that I was interested in science, and so being a physician seemed like a logical next step for me. And so that was kind of the path that I'd intended to pursue. And when I started my education, my undergraduate degree, I started as a pre-med. Okay. And as part of that process, I went and got a certificate as an EMT. And I realized very quickly in that I did not like touching other people. So I kind of had to go back to the drawing board and figure out how do I shape my career in a way that's going to allow me to do the type of work that I wanted to do without being a frontline provider. And so there was a lot of things that kind of crossed my path when I thought about what those opportunities were. But there's a book that I read at the time, which was called Mountains Beyond Mountains by Paul Farmer, and it's incredible. It was basically about the power of public health to do what folks had previously thought was impossible. This particular book was about curing multi-drug resistant TB in Haiti. And I realized that with that kind of initiative and thoughtfulness, you could really make a big impact on a systemic level. And so I shifted my whole perspective and started to pursue a career in public health.
That's amazing. You shifted from saving lives to transforming lives for good.
Well, I hope so, but yes.
Healthcare management is an interesting field. Most of our guests on the podcast have been from the technology sector, and talk a lot about how program management or operations management work in the technical in high-tech field. How is healthcare operations management in healthcare unique and distinctive from tech management?
It's there's a lot of similarities, and I'm fortunate I work at Stanford Healthcare. It's in the heart of Silicon Valley.
Yep.
So a lot of our clients and a lot of the people that we hire are from the tech industry. So they do have experience working in project management in a various number of firms. But what's really interesting about working in healthcare specifically is that it's an incredibly regulated industry. Mm-hmm. So the whole philosophy of move fast and break things that's so popular in tech is kind of impossible with the bureaucracy that exists in healthcare. There's all of these regulations that are intended to keep people safe. They're intended to make sure that the buildings are safe and compliant, that the processes are safe and compliant. And so from a project management standpoint, you don't always have the flexibility to say, these are your deliverables and this is when they need to happen, because frequently people need to send something to the state or send something to a governing body or regulatory agency that we have no control over whatsoever. So their timeline might say it's going to be 2 weeks, but depending on when they get that paperwork back, even if we were ahead of schedule, there's a potential 2-3 month delay with whatever the bureaucracy is doing behind the scenes. And so as you're developing your project plans, you're building buffers into every single phase of your project. And you're trying to understand which things can be done in parallel and which things absolutely must happen consecutively within your project. And so our team, and what I've worked with the team on doing, is trying to understand how you can time these things out and how you can talk to folks so that you're making the best use of everyone's time as you go through your project, because everyone is not going to be running at full sprint for the entire time, and people are balancing a lot of different things because they just know that kind of bureaucracy is built in, which is, I think, very different than what folks experience in the tech industry.
Makes sense. Let's also talk about your leadership experience, right? You have been managing portfolios of 2 billion with 40 plus projects at the same time, right? Which is unimaginable. So how has your leadership journey been, and what are some of the factors that have shaped your leadership journey?
So when I started my career fresh out of graduate school, I was working for a company that was based in Florida, but I was overseeing a California region. My boss was located in Colorado, and I basically saw him once every several months. So I was functioning with an incredible amount of autonomy. And even though I didn't have any direct reports, I had 20 plus accounts that I was managing. And so I learned early on that leadership doesn't require you to have the title. Leadership is about influence, and it's about how you manage your relationships and your deliverables and the work that you have at hand. And that, I think, has been the most valuable thing that I've learned in my entire leadership journey, is that it doesn't, ruling with an iron fist is just not effective. And you can have the title and the backing and all of the support and infrastructure behind you, but if people don't want to work with you, you're not going to move the needle in a way that's going to be significant and impactful over the long term. And so my goal as a leader is to try to put systems in place that make it easy for people to get their jobs done, to make people want to work with me, and also to establish a system that's going to outlive my tenure. So that if I do leave the organization or the role, that the work that I've put in place or the processes that I've put in place are still effective. And when the new leader comes in and they want to shake things up a little bit, they have full capability of doing that, but they're not fixing something that's broken. They're just improving that system, which I think has been really powerful for me. Trying to get folks to just do what you want them to do without getting their buy-in and support through influence is almost impossible.
That's so powerful, right? You are ensuring that the show must go on irrespective of whoever comes next, and they don't get to solve the same problems that you have went through. That's a different way of thinking. I think that's critical. When you are leading such large projects with so many people and such large teams with such a large revenue impact, how do you go about motivating people? How do you ensure your team is motivated and on track to deliver your vision and to follow your leadership?
That's such a good question. I think that there is an intrinsic motivation that I rely on in individuals, but part of how I have shaped my team and ensuring that those folks are happy and enjoy doing the work and get a bunch of satisfaction out of the work that they're doing and also are able to deliver a quality product is I started by peeling back a lot of the bureaucracy. It's starting with talking to them and trying to understand, how do you view your job? How do you view the work that we do? What are your best practices? How do you approach your work? And I talked to not only all of the people on our team, the people that reported to me, but I talked to all the stakeholders that we interacted with too. And I said, basically trying to establish what my value proposition is to the organization. Like, what value does my team bring to you? What do you appreciate about the work that we do? What do you feel is not value added? What do you think could be better about the work that we do? And by developing these things as a cohesive process, in collaboration with all of the stakeholders, you can put something together that people enjoy because they feel like they have some skin in the game and they participated in the process of building the way that they worked. But to be frank, in my current role, when we started, there was some confusion, I think, about what was expected of them and a bit of a disconnect. Project managers, as you know, their closest relationships are typically with the teams that they're working with on a project. It's not with the other people that report to the same boss because they don't really have much in common. And so trying to figure out how to get the team itself to be cohesive and share best practices and learn from one another, you need to actually establish a team. And we did that by doing a number of different things. Partly we focused on team building and trying to remove some of the bureaucracy, those kind of rocks in your shoe that make your job difficult. So we took away some of the things that we knew the team didn't like. But then we also focused on activities with the team that they enjoyed doing. So Stanford has some really wonderful facilities. There's a Rodin museum that's part of the campus. And so, for example, we took the whole team out to do the Rodin Museum one day. We did these about once a month, and they were just opportunities where everyone was unplugged from their work cell phones. They weren't getting pings or emails. The whole team was together. They got to know each other. They got to talk to each other. We did other things. We did cake decorating, like silly things, the kind of forced work fun that everyone kind of begrudgingly participates in. But what that did is it built rapport between people and they started becoming friends. And now they do their own PM lunches together that I'm not even part of because they just like each other and they want to support each other. And I think that when you enjoy working with a group of people that is motivating in and of itself, regardless of how you feel about the work that you're doing. So that, I think, was a huge portion of building this thing that was sustainable. And then additionally, trying to make the work itself fulfilling, not only the process of the work, but the outcome. When someone completed a project, there was broad-facing celebrations of the work that they had done. We do, ribbon cuttings for new openings, or kudos and celebrations, and announce it publicly and share an email to all the folks that were impacted, thanking the people for the work that they did with really, really specific feedback. And not just like a big, thank you, you did a great job, right? That doesn't mean anything to anyone. But these are some very specific things that this person did to make this work come to fruition. And I think people really appreciate that. And it also helps me appreciate them more.
So initially they might be joining grudgingly but they see a value in it in the long term and participate wholeheartedly.
I think so. It's like, when you go to the gym the first time, it's terrible, but after a while you kind of start to like it.
Yeah.
That, I think, is how it felt. It's uncomfortable, especially in the remote world. It's really tough. People are not used to spending time with each other, and it feels like a chore. But in my perspective, bringing people together for something intentional is powerful. Bringing them together for, just to do what they could do on a Zoom meeting, maybe not so much, but actually having dedicated time to enjoy each other's company, I think is really value added.
Makes sense. I think what you just said makes total sense, but I'm sure it's not all rosy, right, when you're trying to make these initiatives. One thing that project managers always one of the skill set that they have to develop is influencing without authority, so that they can manage the pushbacks that they receive whenever they're bringing something new, change, there's always a pushback from existing folks, or it can be anybody, right? So from a leadership perspective, what are your tips on how do you handle these pushbacks? How do you ensure that you get across these roadblocks and still are able to make progress on your vision?
I think it is so unfair when the project manager has to be the one that says, now we're changing the goalpost.
Yeah.
Because the way that that's perceived by the folks that are working on the project is that you, as the project manager, have made this executive decision to change all of our timelines. And we all know that's not the case.
Yep.
The project manager has a much broader purview of the organization typically, and the why behind why these things are changing. And so as a leader, I think it's really important to be the voice of those larger changes that are typically coming down from on high, and starting at a leadership level and letting my colleagues and peers know this change is coming. I'd like you to let your teams know this change is coming so that it's not a surprise when they hear about it on their project meeting. And that's been really successful because there's this intent, I don't know why necessarily, but there's this feeling of an us versus them when you're on a project team, that everyone kind of sees their own lane, and the project manager centrally sees the entire thing. And so they're viewed occasionally like the enemy of the project because they're the one that's getting in the way of people being able to do their job. But we know as leaders that that's not the case. They're the ones that are herding cats to try to get this very complicated thing to fruition. And so by having those more difficult conversations at an executive or leadership level, and ensuring that when the project managers come to the group and they say, okay, this is the change and this is how we're going to approach it, that they're not getting that same level of pushback because folks have already been pre-exposed, and they can actually just start being productive and working forward and trying to find solutions.
Makes sense. Let's talk about decision making. Decision making in healthcare management, right? I think it's a totally different ballgame compared to other industries because the consequences of failure might be enormous and it might also impact lives. When it comes to healthcare management, do you have any take on how, if decision making is different, or how do you go about making difficult decisions?
I think decision making is always difficult.
Irrespective of industries.
Irrespective. And it's so relative because your deliverables matter no matter what industry that you're in. But the interesting thing about working in healthcare is that it doesn't matter if you're delivering direct patient care. You can be a physician or you can be in food services. Your work impacts the patient, and people will frequently self-sacrifice their own well-being for the sake of the patient, whether or not that means, working longer hours or going above and beyond, doing all of those sorts of things. And so the decision-making can sometimes feel like you are in a bind, and the only decision that you can make is for the betterment of the patient. But when I'm faced with difficult decisions, I try to take a more global perspective and think about what is actually a priority both for the organization and for me personally, and where does my moral compass lead. And so for me, it's really important to focus on the well-being of my staff and my team, and take into consideration the fact that people are frequently carrying a lot more than you know that they're carrying, both in terms of their workload and in their personal lives as well. People come and they give themselves 100% at work, and sometimes you get the impression that that's not enough, that they could be doing more, they could be doing things differently. But when it comes to trying to make tough decisions, I think that the number one piece of advice that I've received is to think about, is this a person issue or is this a systems issue? And is there a way that you can fix the system so that it enables all of the people in the process to function with ease? And I frequently found, almost without exception, that it's never a people issue. It's always the way that the systems have been set up have made it difficult for people to give you the kind of deliverables that you want. And so when you're faced with a tough decision, usually what that means is that you've put the wrong systems in place for people to be successful. And then the decision is, do you change the system? And that is hard, but usually that's the right answer.
There's such a fresh perspective. It's not people, it's systems majority of the times that needs to be corrected.
Well, I think it depends on how you feel about people generally, but my philosophy is that people are good and they're willing to try hard, and they're not inherently lazy or stupid, that these are smart people who want to do the right thing, and given the right circumstances, they will.
Makes sense. I am an optimistic person as well, and I like people.
I do too.
But it reminds me of the point in project management. They say, what's the biggest reason projects get delayed? And the common answer that comes up in surveys is people. But it's actually not people, it's their schedules. They're so overwhelmed with their schedules that they can't take time for everything. Thanks for sharing that. So from decision making, I also want to talk about human-centered design. You speak a lot about human-centered design, and I know when it comes to design thinking, when I took the design thinking course, the classic use case that was shared with us was about how General Electric transformed the MRI scan machines using design thinking, right? That's the classic example that's given. In your decision making, leading initiatives in healthcare management, what role does human-centered design play?
I think you're right. When people think about human-centered design, they're typically thinking about a product. The example of GE is fantastic. For folks who might not be familiar with it, essentially they redesigned pediatric MRI machines to look like adventures or underwater experiences, and they equipped the small children with little pamphlets ahead of time to help them prepare for their adventure and what they were going to do. And they found that not only was it a satisfier, they actually were able to reduce the clinical interventions that they did. They reduced the amount of sedation that they were doing for children going through these MRI machines, and overall went from being a very scary experience for children to a very positive experience for both them and their families. And so the product component is huge. But for the work that I do, we're not creating a product necessarily. So when I think of human-centered design, I'm interpreting it in terms of processes. And one of the things, the example that I love the most, although the GE one is a fantastic one, the example that I love the most is the idea for all of the women out there, you know that if you go into a stadium or you go into a large venue, the line for the women's bathroom is always around the corner, and there's never a line for the men's bathroom. And coming from a construction and architectural perspective, they're designed similarly. They have pretty much the same amount of space, but they didn't take into consideration the way that people actually utilize the space that they were in. So women are frequently caregivers. They have children with them or other people that have additional needs. And so the time that they spend in the restroom is longer. They're in a stall as opposed to using a urinal, so their time in their space is longer. And so while the spaces are equal, it's not equitable. And what that means is that there's always a line, and it's a much worse experience for women than it is for men, who can kind of get in and out of those things quickly. And you'd think at this point, when these facilities have been built for 50 plus years, someone would have kind of got the memo. But it takes a really long time, and I think human-centered design is one of the ways that you can address challenges like that. Human-centered design focuses on trying to get in the shoes of the people that are actually experiencing what you're trying to develop. And so you have candid conversations with the people that are using the product. You create a prototype, you test the prototype, you see how that actually works in a real-life scenario. And rather than having a couple of brilliant minds design something that looks beautiful and should be functional, and then put it into place and have it not work that way, you're focusing on the user. And how is this actually going to be value added? And so the bathrooms are one example, but it really applies absolutely everywhere.
Yeah.
There's the example of kitchen tools. So if you've ever used a can opener and it has like the nice grip on it, originally those didn't exist that way. They were they were just pure metal, and they would cause little dents in your hands. But the reason that they were created differently is because they were designed, human-centered design, specifically for someone with arthritic hands. And they found that these solutions that are for a niche population actually have much larger benefits for the community at large. Another example that I love is the slopes on the sidewalks that enable accessibility for wheelchair users. They're also incredibly helpful for parents pushing a stroller, or for people that have limited mobility walking around, for folks that may be sight limited. And so the idea of human-centered design to address the problems of a very specific population oftentimes have much, much broader implications for the rest of the organization or for the rest of the society. And so I try to apply it to all of the work that I do all the time. Even though I think I'm a pretty smart person, I will never just say this is how we're going to do things without talking to the people that are actually doing the work. Because I want to know what their work looks like and what they think. Because they have a unique perspective, but if there's 6 different people doing the job, they all have a unique perspective. So how do you gather all of those together and try to develop something where you're bringing out the best pieces of all of those folks' individual experiences and creating something that's going to be better for the whole?
Oh, that's so powerful. I never thought about design thinking or human-centered design for processes. The discussion has always been on the product side. Thank you for sharing these examples. I think all of these resonate with our audience members. Let's also talk about technology and the role of technology in healthcare management. Generative AI, there's so much hype and hope in these last 2 years on the possibilities of AI, right? But in your journey, in your professional journey over the years, you've seen technology play a role in changing healthcare management. So how do you see AI transforming healthcare recently, as well as comments on technological innovations changing healthcare systems?
I think that it was really interesting when COVID hit and everything kind of moved remote. Prior to that, I was working on a very small pilot project for video visits for a different healthcare system. And we kind of set up a training process and how people could get exposed to talking to their physician using a video rather than coming physically into the office. And the higher ups were not particularly interested in implementing it. They thought nobody's really going to want this. This is not a very good tool. And so while I had a project team that had developed this kind of interesting prototype, it was sitting on the shelf. And when COVID hit, about 3 weeks into it, they said, hey, that thing that you were working on, can we roll that out in like 2 or 3 weeks for the entire organization? Luckily, we've done a lot of the late work, but the technology itself and people's ability to adapt to it, the thing that I found so interesting is that this technology could have worked years ago.
Yeah.
If it was where people wanted to put their effort and the money and backing and support behind it. And so I think a lot of the challenges that you see with technology is mostly the bureaucracy behind people not believing in it, and not necessarily having faith that people would be willing to adopt that new technology. It's the same thing with the whole idea of working entirely from home. There was an idea that people would be less productive. I think anyone who works from home knows that you're generally more productive at home. You get a lot done, you have fewer distractions. There was certainly clunky in the beginning when people were trying to get used to the process, but there's so many incredible tools out there for folks to leverage, simple, I say this respectively, simple technology, things like cloud storage and different chat systems, Slack and Teams, things like that, where you can have, it doesn't have to be AI, it's a straightforward algorithmic-based technology that enables people to do their jobs really effectively. So even though that wasn't a huge leap from what was available beforehand, people found different ways of using it. And I think in the healthcare sector, the idea of AI taking over for physicians it's scary to a lot of people. But if you talk to a lot of physicians, they're kind of intrigued by the concept. And that's mostly because there's so much paperwork and so much bureaucratic kind of components that are involved in being a physician now. It's a different style of practice than what I think most folks were exposed to when they decided to go to medical school. The amount of charting that people have to do, which is basically just putting their notes into the person's electronic medical record and going through the billing process, all of those things are primed for automation. And although it probably could be done algorithmically, it's really complicated. And so AI has the potential to totally change that entire process. And there's lots of different organizations that are working on how they can sort of leverage AI to solve those problems. I attended the Institute for Healthcare Improvements conference this past December, and there was a brilliant computer scientist there, Peter Lee. He works at Microsoft in innovation, and he gave a keynote on AI in healthcare. And it was a little spooky at first because he was using one of the language learning kind of ChatGPT type software to essentially diagnose a very complex case in real time during his keynote speech, and it diagnosed it perfectly.
Wow.
And so there's this thought that it could potentially replace the physician, but that's not the point that he was trying to prove. The point that he was trying to prove is that this can actually reduce all of that research and paperwork that you need to do to be a valuable physician in order to get your job done. And so rather than spending, hours or days looking through medical journals, you can ask ChatGPT or the more sophisticated versions of it some very specific questions about the types of symptoms that you're seeing in the person's medical history, and come up with a series of diagnoses that you could then test as a physician to understand, focusing more on like the human connection and those pieces that a computer is never going to be able to solve. The way that Dr. Lee framed it, which I loved, is that you can view AI as like your really smart, capable intern. They're not quite ready to be the boss yet, but you can leverage them to do a lot of the busy work so that you can focus on those things that are value added for you as a professional.
That's insightful. I think that's why a lot of startups in healthcare are focusing on this topic, right? On leveraging AI and solving some of the busy work that you spoke about, which can automate. So, Max, I would like to switch gear and talk about professionals who want to get into healthcare. A lot of audience members who partner with PMI, who join the PMI's mentorship programs, come from healthcare background, who are performing analyst roles or project management roles, who want to get into project management leadership or even operations leadership, want to build a career in healthcare management. Right? What's your advice to these people on how can they shape their journey towards healthcare management?
That's such a good question. I think I kind of fell forward into healthcare management. It was a set of skills that I felt like I had because I cared about innovation and I cared about people and I cared about science and processes. And it naturally occurred to me over time. But I think it took me much longer than it could have because I didn't understand that the best way to move your career forward isn't always the degree and the experience. It's the connections that you make with people along the way. And had I known this earlier, I would have joined more professional societies. I would have looked for internships and fellowships and not just tried to do a really good job at the task that was assigned to me, but made connections with all of the people that I possibly could. I do this now. I'm very active on LinkedIn, and I try to post about things that I find interesting and try to find a community of people that are in similar fields to me that are doing interesting things, and I just talk to them. I'll reach out to them and I'll say, this thing that I saw you do, I was really impressed by this. I'd love to learn a little bit more about it. Would you be open to a Zoom or a coffee to chat a little bit more? And sometimes people ignore you completely. I don't take it personally, but a lot of the times people are really happy to talk about the things that they find interesting, because as an innovator, as a leader in a field, you don't want to be the only person who thinks the way that you do. And so if you see people that are up and coming or younger in the field that just have that passion but might not know how to start shaping their own future, having that one-on-one connection with them is so valuable for a leader, because then you're able to start shaping what your industry looks like in the future. And I think it's the same in healthcare as it is in any sort of big consulting firm or technology company. There's different ways of leading. And if you find people that align philosophically with the way that you think, you want to help those people. And so even though getting the degree and having the experience and getting the right job is important, so much of it is focusing on the people and the connections that you can make. And so for anyone who's aspiring to get into healthcare leadership or management, I would certainly encourage you to look into internships and fellowships, but also when you're in those spaces, make the most of all of the people that you meet and build those connections. And even if you're not in a place where you can do an internship or a fellowship, look at the people that are working in the industry, find folks that are active in the industry. It's really easy. You can look them up on any company's website and figure out who works there, and just reach out to them and see if they'd be willing to talk to you. I can't tell you how many people I know that have gotten their first job because someone knew someone that helped them get a foot in the door. I say this frequently. Stanford is an incredible institution. It is harder to get a job at Stanford Healthcare than it is to get accepted at Stanford University. There are hundreds of applications for every single job, which makes it really tough to stand out. But if someone can vouch for you and they can say this person is really driven, they're really interesting, they would be great to work with, then you at least get the opportunity to interview, and that is half the battle.
That's half the battle. I totally agree to what you said, and I couldn't have found someone better. The way you articulated it, it totally makes sense. I mean, I'm super glad that you're having this conversation. Speaking of reaching out, can you also talk about the role of mentorship in building these connections, in having these meaningful conversations? I know you spend a lot of time with blue-collar workers, getting them into healthcare and other sectors. What's your take on the role of mentorship? How can one approach mentors and utilize the mentorship opportunities?
It's a great question. When I was younger, I didn't see the people. I didn't even know that the job that I have now existed, and so I didn't know, based on the people that I had around me, what mentorship could be. And as people I think when you're an undergrad, people are always saying, go find a mentor. And it's so hard. Yep. Because how do you reach out to someone who just seems worlds above you to try to ask them to help you? I was so embarrassed, and I never did it. I never reached out to anyone to say, can you help me? And I think that for people who come from a similar background to me, you don't know how to do that at all. And so after I got into a position where I had, a little bit of power and influence, I thought, I need to figure out how I can leverage what I've been able to build and expand my network. And so I proactively seek out mentees and people that I can help. And it's not always a formal relationship at all. Sometimes I will, see someone who is at a talk that I'm giving or at a conference that I'm attending or at the same talk. And they're the one that's kind of quiet into the corner, and I'll just go up and talk to them, and I'll say, tell me about what you're doing, tell me about what you're interested in, tell me a little bit about yourself. And then I try to leverage the network that I have to make the right connections for that person, because I might not be the right person for them, but I know how it feels to be too shy to ask for the help that you need. And it slows you down, and I think it's so unfair that people who kind of have a silver spoon, not because they're wealthy, but because they have the right connections from a very young age, they move so much quicker up the corporate ladder, or they can advance their careers so much quicker because they have the right people in their network to reach out and get advice. And so I encourage all the people who are from backgrounds similar to me, first generation professionals, to leverage what they've been able to build for themselves, and don't close the door behind you. You have the opportunity to create a totally different dynamic in the working world, and I think it's really important for people to leverage that as best they can. I don't want to put the pressure on the mentee.
Max, I'm enjoying this conversation so much. I can keep talking forever. But in the interest of time, this is my last question to you. What inspires you to keep innovating, to keep pursuing the leadership journey, to keep innovate, to make a difference in someone's life? And what's your message to our audience who are trying to get into healthcare, or even who are trying to move into leadership positions? How can they keep motivating themselves to make a difference?
I think that it's really important that you pick a field that you are passionate about. I love working in healthcare, but it's not an easy place to work. In fact, it's very, very difficult. There's incredibly high amounts of burnout in the healthcare field. I read something recently that said about 70% of people that work in healthcare are experiencing some sort of burnout, and that's not just frontline clinicians, that's everyone. Because I think there's so much on the line, and you feel this constant pressure to make things better. And for me, the main motivating factor is the people who are doing the work. There is always going to be a need for healthcare, but when I see a statistic saying that the vast majority of people who are in healthcare are feeling burnt out, and that physicians are not encouraging their own children to go into medicine, it makes me really worried about what the future could look like for healthcare. And when I think about what motivates me the most, It's trying to ensure a sustainable workforce. It's getting the jobs done, but it's also ensuring that people like what they're doing and that they want to be here and they get a sense of satisfaction out of the job that they're doing. And I don't want this to be a thankless field for people who are not on the front lines. I work in infrastructure and facilities, and we build buildings. And I will say that before I had this job, I didn't think about the buildings at all. I didn't think about the fact that there was hundreds of people behind the scenes making sure that the HVAC systems work and that the toilets flush and that the building stands up when there's an earthquake and it's heated appropriately and cooled appropriately, and that all the things happening behind the walls are functioning at 100% capacity. It didn't even cross my mind. And I say that because it can be thankful work. It could be thankless work. Thankless work. But if you as a leader can focus on the people doing the work and make sure that they feel recognized and appreciated and that their work is valued, then I think more people will want to come into those fields. Like, I know that I would recommend to anyone to work in the type of industry that I work in. And I want the people around me to feel that way as well.
Max, you're definitely a trailblazer, and I wish you all the best. It was a pleasure talking to you, and we would like to have you once again on the podcast.
Anytime.
Thank you for being on Mentorship Masterminds.
Thank you so much. I appreciate it.
Thank you for tuning into today's episode of Mentorship Masterminds. Today's session on healthcare management with Max. I'm sure you got some leadership nuggets that would help you in your leadership journey, irrespective of whether you are in healthcare sector or outside the healthcare sector. To listen to similar topics on leadership, innovation, and growth, tune into Mentorship Masterminds with me, your podcast host, Mahesh Deshpande. Until next time, keep thriving, keep inspiring.